Now we'll go on to our keynote speakers this morning. We have 4 of them. Those are their names. And first, I'm happy to give the floor to Professor Otto Kars, founder and senior advisor of REACT here in Uppsala. Welcome.
Thank you. Dear Minister, dear Deputy Vice Chancellor, colleagues and friends, I would also like to heartily welcome you to Uppsala to this Health Summit. I have had the privilege to work on the issue of antibiotic resistance for 20 years with the support of the Swedish government, the Swedish International Development Cooperation Agency, SIDA, and Uppsala University. I'm really excited about the enormous momentum of the issue that has achieved lately, and specifically this last year. Numerous national and international activities in different parts of the world, from policymakers, professionals and civil society organizations, has led to rapidly increased awareness and paved the way for the collective global commitment to the issue. My presentation is not up, I think.
Oh. I think you have most of it in your head. Already.
Well, I need to sure, but I would like to show my slides.
So let's see if they can find it. Well, you must be happy, Otto, now with the world leaders on your side.
Yeah, absolutely. But it's not, as I will conclude, it's just the beginning, the end of the beginning. I will try to talk without the first slides, though, but I hope that will come up soon. The recently adopted Global Action Plan is one of the most important signs of this new global commitment, of course. We will hear more about this Global Action Plan and the role of WHO in a few minutes, but let me just say that now we should not expect that WHO should be able to deal with all aspects of this huge, dynamic, complex and frightening crisis. Although the capacity of WHO surely needs to be significantly strengthened, the solution is not just to send checks to the organization. The task is massive and needs to be shared by all of us. WHO should have a core function as a leader and coordinator, but has to rely upon countries and all levels of society within countries. The landscape of initiatives is rapidly growing. This is just a few examples. There is clearly a strong need for coordination of the global efforts. I don't think that we can afford fragmentation of the world's response to the new Global Action Plan. We are framing this issue in a little bit technical way, antimicrobial resistance or antibiotic resistance, but the real challenge is access. Today, more than 500,000 people are dying due to infections caused by antibiotic-resistant bacteria, and more people around the globe is talking about the fear of a post-antibiotic era. That fear is highly legitimate. However, let us just be reminded that large populations in the world have never entered the antibiotic era in the first place. According to the most recent report from UNICEF, fewer than a third of children across developing countries with suspected pneumonia receive antibiotics. And according to the latest Global Burden of Disease study, 4.8 million people die from preventable bacterial infections, most of them because of lack of access. Antibiotics are the cornerstones in any health system and are essential for basic medicine as well as highly specialized medicine. The pyramid of medicine is built on these miracle drugs. But today, these pillars are rapidly crumbling, potentially causing collapse of our entire modern medicine. As it is now, many parts of our society have become entirely dependent on, even addicted to antibiotics. The same situation applies to the animal sector. Also there, non-sustainable systems have been built on antibiotics. So, clearly, a One Health perspective is crucial to understand the issue of antibiotic resistance. Humans, animals, and the environment are intertwined and needs to be considered as integral parts of a larger ecosystem. Without taking all parts of the system into consideration, we will not be able to create sustainable solutions. But when it comes to solutions of the problem, it goes far beyond these 3 areas. antibiotic resistance is a societal challenge that needs political will and buy-in from many more areas and will require an unprecedented change in social norms, global collaboration, and governance. Now, this is not only a health issue. It's a challenge to global economy and development. Again, this means that many more parts of the society needs to get involved, including the aid community. Antibiotic resistance is also an issue of solidarity. The promising development we have seen in many parts of the world in relation to fulfillment of the Millennium Development Goals have in many ways been underpinned by the use of antibiotics. And without effective antibiotics, some of the progress will become undone. So therefore, I think it's surprising and even alarming that access to effective antibiotics or antimicrobials are so far not mentioned in the process of the new Sustainable Development Goals. Now, antibiotic fits well into what is described as a super wicked problem. Such policy problems are, by definition, immune to quick, technology-driven fixes and require the consideration of a much broader range of potential solutions. There are 4 criteria for a super wicked problem. The time for finding a solution to a policy change is running out. Those seeking to solve the problem is also causing it. Central authorities to address the problem are either weak or non-existent. Policy responses are not proportional to the cost of non-action. And furthermore, and this is important, super wicked problems require a shift from policy trajectories. Incremental changes to existing policies or structures will not be sufficient. We simply need to build new ones. There are also many ethical considerations here that the world needs to deal with. Do we have to ration the scarce global resource in the future? And where should such decisions be taken? One ethical challenge is the one of fair distribution. Since the burden of antimicrobial resistance is disproportionately affecting low and middle-income countries, it has the potential to widen existing discrepancies in health outcomes in regions. Another ethical challenge is that of intergenerational justice. If it's not fair to leave future generations without effective antibiotics, how should we allocate this increasingly scarce global public good? The antibiotic crisis has frequently been compared with the crisis of climate change. This analogy is effective and attractive. However, there are major differences. First, for antibiotic resistance, there is probably less scientific controversies. Good. But more importantly, while climate change has the advantage of actually having alternatives to shift to, like solar or wind power, for antibiotic resistance, there are today no alternatives for replacement. Discovering new antibiotics is therefore crucial. However, much stronger efforts are also needed to focus on the research agenda for alternatives, both for treatment and for prevention. This slide is just a reminder that as long as we're using antibiotics, resistance will not go away, even if we use them in a perfect manner. We must address the critical imbalance between supply and demand. To restore this balance, it's critical to build a new and sustainable system where 3 components are core: access, conservation, and innovation, working together like a tripod. Access to effective antibiotics must be seen as a part of the right to health, and improving access is a key to global commitment to antibiotic resistance. Conservation of antibiotics need not only to deal with the obvious uncontrolled use and misuse of antibiotics in different sectors through strengthening regulation, education, and not the least by removing misaligned financial incentives, but also to address prevention of spread in the community, healthcare, animal production, and environment. The third leg in the tripod is innovation. We are facing the fact that the market-driven innovation system has collapsed, and the world's innovative capacity for novel antibiotics is dangerously low. The existing examples of public-private partnerships to reinvigorate the development of novel treatments and diagnostics are far from sufficient, as I see it. New international collaborative and financing functions need urgently to be formed. And in the new financial models to be developed for research and development, the return of investment needs to be delinked from price and volume sales to facilitate a rational use of the product. In summary, we need to look upon antibiotics as a global public good, and we need to reform a failed, non-sustainable, and inequitable system. A new global order is needed. In the media, the antibiotic crisis is very often described as if we are losing the war against bacteria. I don't believe that anyone in this room thinks that winning against the oldest inhabitants of this planet neither is a very good thing nor possible. Instead, I think we have to fight against the war metaphor and for a better understanding about microbes and the essential role they play in our ecosystems and lives. But having said that, though, I could not resist to close this intervention by a quote from one of Winston Churchill's speeches. Now, this is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning. We now have a global action plan around which the world needs to build new global infrastructures, international binding agreements, and financing mechanisms. This will not be easy and cannot happen without strong political will and courage. And the new political alliance mentioned by our minister is a good sign of political will and forward-looking activities. However, I am convinced that we will succeed, and that the antibiotic crisis, like Ebola, will lead to an understanding of how infectious diseases links the world together, and that we will not succeed without strengthening the world's weakest health systems. Now we must not only keep the momentum, we must increase the momentum. And following the Global Action Plan, concrete steps need to be taken, and Uppsala Health Summit hopes to identify a few of those. We people in this room, we don't need more awareness. We need to start to talk about actual actions and how to move forward in a close collaboration towards the difficult decisions the world leaders must to take. And I hope that these 2 days will be giving us some concrete steps in this direction. Thank you very much.
Thank you, Otto. And please come and have a seat here. And while our next speaker, Jill Forte, is coming on stage, I'm going to ask you something, Otto. The ethical dilemma here,
yes.
And I'll put the question very crudely. When there is a new effective drug, can we give access to it to countries who cannot control the use?
I've heard this question before. I've even heard people from the low-income countries saying that they should not have access. I think we need to see this very critically. Let's say that we have the major pathogen causing pneumonia will be resistant. And if there is a new drug available for treating pneumonia, we simply must allow that drug is going to be used in the countries that need it. So what we have to do is to try to prevent as much as possible to come into that difficult decision. And we can do that by many means. First of all, we need to check what antibiotics are really working. Because, as already alluded by the minister, we don't have a decent surveillance system. We're relying on effectiveness of antibiotics by highly fragmented, selected data that could be overestimating resistant infections. So we need to have a quick surveillance over the world to see what drugs are working. Yeah. Then, of course, everyone needs to agree upon when antibiotics doesn't work. And that is a huge thing, but could really lead to a reduced demand. So, I mean, surely we need to give access to everyone in need, but we need to fix the systems in parallel.
Yeah, your Dr. Hart is talking. Otto, you can sit down. And Gilles, are you somewhere ready? Yeah, this is Gilles Forte from the Medicines Program Coordination at the World Health Organization. So with the new action plan...
Morning. Good morning, everyone. During the 10 or 15 minutes that we have, I'll talk to you about the Global Action Plan and where we stand with its development and the recent discussions that took place at the Assembly. So as it was mentioned this morning by the minister, I think there is an urge for action, and this is motivated by the increasing public health threat that antimicrobial resistance presents, and we have a number of data around that, and a number of the problem is that more and more common infections are becoming untreatable because of the resistance, and more patients are staying longer in hospital wards, and more deaths, also 25,000 per year in the European region only. Antimicrobial resistance creates also a serious economic burden on economies, and there are some facts for that, 1.5 billion euros per year in the EU, but also some estimation on how the burden will be between now and 2050, for example. And then finally, a very strong commitment and very strong from the member states, from the politicians, from the health professionals, from the public, who is becoming more and more aware of the challenges of antimicrobial resistance. And this has materialized by the recent discussions at the World Health Assembly, and in 2014 first, where the first resolution in the last couple of years was endorsed, and this resolution was engaging the WHO Secretariat to develop a draft global action plan in order to help tackle the problem of antimicrobial resistance at the global level, but also to encourage and to get the commitment of the member states to themselves develop their national plans. So this plan has been developed through a very thorough consultative process involving a number of partners, involving the public, civil society, private sector. And this global action plan has been discussed at the very recent World Health Assembly 1 week ago in Geneva, and it has been endorsed through another resolution that was passed in few days ago, and for which I will tell you more about that in a few minutes. The goal of the Global Action Plan, I think you are maybe all familiar with that. It is to ensure that prevention and treatment is carried out effectively using efficacious, safe antibiotics and in a responsible way. This plan places health at the center of the global concerns, but also acknowledging the importance of the involvement of other sectors like agriculture, environment, and food sector. So I think it's important that we perceive and see this plan as also inclusive to address a health issue. It provides also, this global action plan provides a framework for countries to develop their own plans. And the plan also tries to identify the roles and responsibilities from the various stakeholders, member states, civil society, and the WHO Secretariat. You are also probably familiar with the 5 strategic objectives that have been identified, and that the member states and the Secretariat are meant to address. The first one is about improving awareness and understanding of antimicrobial resistance through effective communication. The second one is to strengthen knowledge and evidence-based through surveillance and research. And Otto was mentioning the lack of data on antimicrobial resistance, but also the lack of data on medicines consumption. And there is an urgent need to fill in this gap. Also, the third objective is to reduce the incidence of infection through various measures to control infection, good sanitation, hygiene, and so on. The fourth important strategic objective is to improve the use of antibiotics and antimicrobial, and to make it as optimal as possible. And the fifth is to develop the economic case for sustainable investment, be it for the research and development of new medicines, of new diagnostics, of new vaccines, but also look for a sustainable, strong health systems in countries. So those are 2 key areas of work that will require attention and investments in the future. The guiding principles for the Global Action Plan, but also for countries to develop those national plans. The plans need to engage, as we said, all the sector concerns. It has to be articulated around the One Health approach and engage the health sector, but also the agriculture, the food, and the environmental sector. So it's a collective effort at global, but also at national level to really define what will be the key interventions that will have to be put in place to mitigate and to combat antimicrobial resistance. Prevention is also a very important principle. Everything has to be done to contain infection, to prevent them. Access to medicines, vaccines, interventions, diagnostics that are already existing, but also that need to be discovered. I think this is critical to make sure that the proper antibiotics are available and that are used responsibly. Sustainability also it's a critical principle. It's important that whatever action, whatever investment is made, it can last on the long term. So I think whenever we are going to start the implementation of this work, I think it's important that we have that in mind. How can we contribute to a long-term benefit from this plan and from these interventions? And then incremental targets, acknowledging the fact that countries are at different stages in this process. Some have developed already plans, some are actively engaged in fighting antimicrobial resistance, some are not. So therefore, those plans should reflect the priorities and the needs of the various countries. So if I come back to the resolution that was endorsed 1 week ago, and also thanks to some of the colleagues that are in the room here representing the member states, I want to acknowledge Ghana, Thailand also have been actively contributing to raise this agenda in the international scene, but also actively involved in the formulation and the commitment of about 60 countries have been sponsoring this resolution. This is quite unprecedented sign of commitment for this very resolution. So the resolution that was adopted in 2015 is meant to adopt the Global Action Plan. The Global Action Plan per se is a plan, but it's not a committal document according to the WHO rules. So therefore, there was a need for a resolution to make sure that the plan was endorsed by the 194 member states. Secondly, this resolution urged member states, and this probably and certainly is in addition to what's in the plan. I think this resolution is meant to emphasize important issues for member states that need to be considered by the member states. So therefore, make sure that all the recommendation and proposed action for member states that are captured in the action plan are implemented. So this is an important commitment from member states. Second, to mobilize human and financial resources to make sure that this plan can be implemented, and encourage and convince all the partners and the donors, but also look internally what are the resources for funding this plan. And then commit to delivering within 2 years a plan that takes into account the country priorities and needs, and taking into account the various guidelines that are available from WHO, but also from the other international agencies and other groups like civil society groups. The place of the partners also has been highlighted and emphasized, the importance of the role, as Professor Kars was mentioning before. It's in the resolution how important it is to have everybody, all agencies concerned, to contribute to this plan. I think this is critical. And then responsibility given to the Secretariat, to the WHO Secretariat, through the Director General, to implement the actions for the Secretariat that were identified in the Global Action Plan, but also develop a framework for monitoring and evaluation of the plan. We want to know every year, every second year, how much progress has been made, how effective the plan has been globally. To promote affordable access to existing and new antimicrobial medicines. Again, what's in the resolution is meant to emphasize the importance of some of the actions that were already identified in the global action plan. So therefore, the issue around access to existing new medicines was emphasized, but also the importance of strengthening systems. It has been said in the two previous presentations how important it is and it will be to strengthen systems in order to ensure antimicrobial resistance. So again, it was emphasized in the resolution. And then the provision also of technical support, of collaboration with member states was also highlighted as a commitment from the Secretariat. So this is worth acknowledging. Just to give you a quick idea of where we are at the regional level, there is work ongoing within the 6 WHO regions. Some regions are more advanced than others. Some have developed some regional surveillance systems. They have developed also within those regions, a number of countries have adopted endorsed plan, are moving with concrete work. Some others not. In the European region, for example, through the ECDC and other groups, I think a lot of work has been carried out. There is also a lot of effort done for raising awareness, and the awareness day that is also organized every year. So therefore, there are a lot of initiatives, and recently also a number of regional offices of WHO have also convened regional meetings to discuss the implementation of the Global Action Plan. I would mention the African region with the leadership of Ghana and South Africa, but also these regional consultations have taken place also in EMRO, in the Middle East region, and in other regions as well. So regions are starting to mobilize, but I think one of the challenges is to try to integrate and to keep abreast of what's happening in the various countries and various regions, and to make sure that everybody moves in the same direction, and that in a coordinated and consolidated way. So this also gives you an idea of the extent of the task and extent of the work by supporting and by trying to engage various countries and regions in this work. A 2015 survey also from WHO has captured also has been taking stock of where the WHO member states stand in terms of the development of the national plans, but also in terms of the establishment of governance structures at country level in order to start with or to continue the work towards achieving the objective of the plans. And this survey has told us that actually 1/4 of the countries have declared having a national plan. This doesn't mean that countries are not actively involved in tackling AMR, but certainly having a plan will help prioritize and deliver on activities, and will help also stimulate a collective action, because if countries, this is also a way of measuring progress in achievements and try to bring countries together. Finally, if times allow, I just have a few more slides, just to say a few words about some principles about implementation in a few minutes. Discussions are ongoing at the moment within WHO as WHO Secretariat, and very soon also probably with the WHO partners, be it international agencies, private sector, public sector, to really discuss what are the next steps for implementing the Global Action Plan. And I think I have to congratulate the organizers of this meeting, actually, because this meeting is very timely. I think the Global Action Plan has been adopted last week, and I think it's a very visionary sign. I mean, to already 1 year ago maybe plan for this meeting to discuss the implementation of the plan. So really, I do commend the organization of this meeting. And probably and hopefully after the 2 days, we'll be able to have more clear ideas that we will be able to feed also in the more global debate. And finally, I think obviously the important principles are to establish a very strong governance at global level secure investments, secure the participation of all the partners, make sure that civil society and other groups are involved and contribute to the implementation of the plan. And also at country level, also work with countries, collaborate, facilitate sharing of experiences, support the champions in the various regions to help each other to work together, but also use what is already existing in terms of the momentum and the dynamic in countries, but also in regions, and to build on that to make sure that we use all the energies and the knowledge to contribute to the building of the Global Action Plan. Thank you very much.
Thank you very much, Gilles. And please take a chair and sit here beside Otto, and I'll call Dr. Suit Vibulpol-Prasert from the Ministry of Health in Thailand. And since you don't have slides, I'm officially cutting you down to 3 minutes. No, I'm joking.
To help my life out. Good morning, global health leaders. And also good morning, the World Health Organization Global Action Plan on AMR. As a global health advocate, I was quite surprised when I received the invitation to this health summit. How dare a university in Sweden convene a health summit, not WHO? I got the answer yesterday when I visited the museum, Gustavinum. The long history of the university is full of great leaders like Ruth Beck, Linus Celsius, and 8 other Nobel laureates. Yes, it is this huge social and intellectual capital of Uppsala University that makes it a global authority on global health and justify its convening power for this health summit. I was also very much impressed how much the university invests in preserving their huge, precious wisdom and spirits in their museums. This is the factor that prevents your failure. Now come to the issue of AMR. Yes, AMR is a huge problem, and it kills millions each year. Yes, there are movements globally to raise the AMR high in the global health agenda. Yes, indeed, the World Health Assembly last month has just approved a resolution and the Global Action Plan. After several days of serious discussion and negotiation, it is indeed a great success, initial success. But my dear leaders, we are not there yet. We must always remind ourselves when we succeed on anything that success is the beginning of failure. Why? Is AMR a health problem? No, it is a complex, challenging social problem. But we agree only among health ministers. Not yet there. We were lucky on Tuesday morning. His Excellency Gabriel, are you still here with us? I think he has left. Okay. This is usual. He boldly convened 14 health ministers in a breakfast meeting. I was the alternate chief delegate supporting my minister there. When we received the invitation, only the minister attended, no supporter. So I have to send my minister to a place where he himself may not even know what would happen. But they came out with a call to action. They want to do more together. They want to move this to the high-level meeting of the UNGA. It's there that it is really multi-sectoral. It's there that may be a real initial success. Even that is still initial success, but the real one. Now, in the past 2 decades, there are many global action plans, global strategies and action plans in the World Health Assembly, in the UNGA. But the gaps between commitment and implementation are not small, are still there. In the World Health Assembly last month, where we commit for the Global Action Plan, there was a side meeting. And my minister, Professor Lachata, said in the meeting that actions without planning is better than planning without actions. And that's true. At least in Thailand, 60% of the actions recommended in the action plan has already been implemented without any national comprehensive integrated action plan at all, but implemented. So how can we be sure that the AMR Global Action Plan approved at the Health Assembly or even the UNGA will be successfully implemented? Can we depend on WHO? We request Director General to do this and that a lot. Those requests from us, not very many of them happen in real life. In the past, so many resolutions. The whole UN and the WHO system is in a challenging situation. Charles Cliff, who is here from Chatham House, led the WHO reform movement, come up with reports. He dare not put into the report my recommendation that this organization has no hope for reform. It can only be reborn. As now agreed with me by John Arn. Previously, he also didn't agree with me. Now he starts to agree with me. How are we going to tip the situation of AMR around the world? Here are some of my humble proposals. A proposal from a retired, unemployed senior citizen from Thailand. Number 1, we must make the AMR a sticky global priority social issue. Stickiness is one of the 3 most important factors to tip the situation, as described by Malcolm Gladwell in his book, Tipping Point. We should learn from the cases of Ebola, which killed less than 10,000 people. We should learn from the case of avian flu, which killed a few hundred people. Why the 2 issues got extremely high attention from the public and stick on for months and years, and huge effort and progresses have been made on the 2 crises. We should not envy them. At least they stimulate so many people to wash their hands with alcohol gel, which help a lot to reduce infection and reduce the use of antimicrobial and support AMR. So don't envy them, but learn from them. We need strong involvement of global leaders, and especially the media and communication specialists and social marketing specialists. I'm very glad that we have media, like The Guardian here, involved in this summit. But we need more than The Guardian. The Guardian is great, but we need more than that. We must be able to create good storytelling and continuous movement to catch the media attention, not only during this summit, but continuously for weeks, months, and years, like Ebola. Number 2, we need more leaders that commit to AMR. We need more political leaders. That's why we need to support the movement to the UNGA. Leader at the top level. But we should at the same time hold them accountable for what they commit within your own country and globally. Not only political and bureaucratic leader, we also need wise, charismatic, influential, and fully committed full-time leaders on AMR, not part-time or once upon a time like most political leaders, as well as myself. These wise, charismatic, influential, and fully committed leaders, they are real champions. They are real champions. A good example is there, Otto Cars. I'm glad that Uppsala University didn't allow him to retire and still use his social and intellectual capital to move on. But one day, Otto will retire from Uppsala University. But we, the global community, should not allow him to retire from AMR until the last day of his life. Do we agree with me? Yes. To tip the situation, these charismatic leaders should be in different skills. There are at least 3 skills that we need from leaders to change the situation. First, the Marvin, to be a Marvin, knows everything, like Otto. Second, to be a salesman who can convince people to commit. Otto may not be a good salesman, but we need another leader who is a real good salesman. Third, we need a connector who can connect all leaders to commit. Number 3, we need to move towards creating conducive environment or context to facilitate, to tip the situation. If you want to learn how, come to the Access and Excess session. After this session, I'll tell you how. Because the moderator told me that I have to finish now. Lastly, number 4, we need to implement powerful strategies. In Thailand, we believe in the strategies of triangles that move the mountain. Triangle. The triangle are power of wisdom, social power, and political and policy power. We need to strengthen all 3 powers and link them to be a powerful triangle to move the mountain of AMR. In conclusion, to conclude, my fellow global health leaders, last month, my minister also said in the World Health Assembly that planning is like a sweet dream. We just have finished our sweet dream. Implementation is hard work, and evaluation can be like being tortured. It's time now for our hard work. Whether or not we'll be tortured depends much on how successful we are in strategically implement the gap and national action plan, and finally tipping the situation of AMR. Let's collectively move the AMR to the top level of multi-sectoral commitments and stick firmly to all mind at all levels. Let's identify and support and recognize more champions at all levels. And finally, let's move strategically and continuously. Cheer.
And our 4th keynote speaker this morning is John Ryan, who is Acting Director of the European Commission Public Health Directorate.
Good morning, colleagues, ladies and gentlemen. I'm very grateful for the opportunity to say a few words from my perspective as the Acting Director for Public Health within the European Commission. As Commissioner Andrew Kaitis' video made clear, the European Commission is committed to addressing the problem of antimicrobial resistance. we are already taking forward a number of actions which were identified in the EU Action Plan on Antimicrobial Resistance published 3.5 years ago, and we're now in the process of reviewing the plan to see what further initiatives are required. So this conference is very timely from that point of view. The EU Action Plan is based on a One Health approach and aims to involve all sectors and aspects of antimicrobial resistance. The objective is to strengthen the prevention and control of antimicrobial resistance across all sectors and to secure the availability of new antimicrobial agents. We published a review of progress in March of this year, which shows mixed results. On the plus side, we know that some EU member states have been successful in improving practice in their use of antibiotics. Some countries have also contained or reduced cases of resistant infections. Unfortunately, despite these successes, the overall picture clearly shows that we still have a very long way to go. So we need to step up our efforts. An example of the areas where we have not succeeded so far is the area of the improved business model for new pharmaceutical agents or new antimicrobial agents. And I remember standing on a stage in Stockholm during the last Swedish presidency discussing this with Professor Otto Kars, and I'm afraid the progress that we have achieved since that conference has not been very spectacular. So this is clearly one of the areas where we still need to invest. The European Union has a key role to play, both within the European Union and externally. In the field of human health, according to the European Union treaties, it's mostly the member states who have the principal responsibility. But the EU is still helping with a view to coordinating actions by member states to provide, for example, EU surveillance data, including indicators at EU level, to develop and share guidelines and good practice, public awareness campaigns at the European Union level, and providing expertise through our agencies such as the European Centre for Disease Prevention and Control, the European Medicines Agency and the European Food Safety Authority, to link also the efforts to combat AMR with the efforts to improve patient safety and reduce hospital-acquired infections. This is not only a public health issue per se, but it's also a sustainability issue for some of our health systems, which, as you know, are undergoing economic difficulties at the moment. Just to give you an idea, at the European Union level, we're talking about a burden of 25,000 deaths per year due to antimicrobial resistance, and an estimated cost to our health systems of 1.5 billion euros per year. So this is clearly a heavy area of expenditure as well for our healthcare systems. And this is destined to grow unless we can manage to bring this situation under control. Another area I'd just like to mention quickly where we're hoping to assist the member states is in the area of joint procurement of medical countermeasures. We've put in place a new mechanism to allow the member states to purchase together medical countermeasures for communicable diseases, and the idea of joint procurement for new antimicrobial agents is under examination at the moment. We're also very committed to working closely with the World Health Organization and trying to implement the new Global Action Plan, which will be a major challenge in the coming years. We're working as well with the Organization for Economic Cooperation and Development, the OECD, to develop an assessment of the impacts and costs of antimicrobial resistance. And we're using our diplomatic and external links to take forward the antimicrobial resistance agenda internationally. On the 7th and 8th of June, for example, the President of the European Commission, Jean-Claude Juncker, will participate in the G7 meeting, which will be hosted in Germany, and where antimicrobial resistance is a key point on the agenda. I invite you to look carefully at the commitments which are made at that meeting on the 7th and 8th of June, because there will be strong commitments made by the G7 countries in the area of stewardship of antibiotics and not only in the human health but also in the veterinary health area, but also a number of other engagements which will be made by the G7. I think this is a strong leadership signal from the G7 countries. In addition, in October of this year, the European Commission will host, together with the Luxembourg presidency of the European Council, a conference with the United States in relation to the Transatlantic Task Force on Antimicrobial Resistance, the so-called TATFAR process. And this meeting will examine how to take this process forward and expand it in the coming years. The latest progress report from the TATFAR, this US-EU joint task force, was published in May of last year. We also hope to create a coordination group within the EU Health Security Committee in order to look at the coordination of public health measures on antimicrobial resistance, and we'll be discussing this with our member states later this month. I'd like to talk now about the area of research, where we have invested in the Innovative Medicines Initiative, which is Europe's largest private-public partnership established between the European Federation of Pharmaceutical Industries and the European Commission. It aims to improve the drug development process by supporting efficient discovery and development of better and safer medicines for patients. With a budget of more than 650 million euros, this initiative aims to reinvigorate antibiotic development by supporting projects covering all aspects from the development of new agents through the development of new business models. As I said, this has not yet been done. It's work in progress. And I note that several of these projects, these successful projects under the Innovative Medicines Initiative, are coordinated here in Uppsala University, which again shows the leadership of the university in antimicrobial resistance. In the veterinary field, efforts have also been made to harmonize and integrate the surveillance of resistance along the food chain. This will allow a comparison between our member states, but in particular between the animal and human situations. In agriculture and animal health, let me mention the proposals for the regulation of the European Union on veterinary medicines and medicated feed, which were proposed last September by the European Commission. They're now being examined by the European Parliament and the European Council of Ministers. These proposals seek to strengthen EU action against antimicrobial resistance by providing new regulatory tools to the Commission and to the Member States for reducing the risks to human and animal health of the use of antimicrobials in animals. The proposal on veterinary medicine contains, for example, provisions on the collection of data on the sales and use of antimicrobials. It provides incentives on the development of new antimicrobials and strengthens the prescription requirements and the retailing conditions for veterinarians, and provides the possibility of reserving certain antimicrobial agents for human use only. I would like to finish emphasizing that the fight against antimicrobial resistance will, of course, not be won unless we can secure the efforts and united commitment of all concerned within Europe, but also globally. The European Commission therefore very much appreciates the opportunity to engage with partners from around the world at this important event in Uppsala, and we're looking forward to learning from the discussions. And I'd like to pay particular tribute to the Swedish government for the strong leadership role in pushing forward policy improvement on antimicrobial resistance. They've also been joined in this role by the United Kingdom, by Germany, and by Netherlands in particular. I also congratulate the organisers of today's conference for this initiative and for the excellent pre-conference report, the scientific report, which contains a wealth of data and analysis. So if you haven't read it, I recommend it to you. Thank you very much.
Thank you. So we have just a few minutes, so we're going straight to, I think, Uppsala University in the shape of Otto can ask a question. I know he wants to talk about the IMI. Is there something you want to ask?
Well, I think John Rainer already responded to this. I mean, first of all, I think this is a huge investment, and it's the best public-private partnership in its kind in the world. Although, as I've heard, one of the programs that they run here from Uppsala promised to deliver one new antibiotic class, or at least the vision is to deliver one new antibiotic class with a mechanism of action by 2019. So that is not sufficient. We need to scale up this globally, but I think it's good. But the missing part is what you said about the use side. Who is going to own this? Who is going to sell it or not sell it? And where is the controlled distribution use? So I applaud the initiative of looking into procurement systems, because I think that is one way to go globally, that there's a public procurement of the new effective antibiotic medicines.
Yeah, do you want to respond to that, John?
I think procurement is a bit of a Pandora's box because it contains as many problems as solutions, but I think it's one avenue that we're looking at the moment. We have the legal tools to carry out this joint procurement. I notice that many of the member states in the European Union are also considering joint procurement for orphan drugs at the moment. This is very much in the news, and also for hepatitis treatments, for example. So the member states are also asking for a better solution to a sustainable pricing system for pharmaceuticals. One of the other aspects which was looked at the time of Tamiflu was the issue of stockpiling, and linking joint procurement, stockpiling and stewardship together in a new model, I think, is something that we need to look at seriously as well, especially if you're talking about keeping a strategic reserve of new antibiotics.
And even the old ones, in fact, because they are not available all the time. Yeah.
Last week, the European Parliament adopted almost unanimously, with 637 for and 32 against, a resolution that was quite tough to fight drug resistance in Europe. How can the Commission take this initiative further?
The Commission will look at the resolution of the European Parliament together with our own evaluation of the action plan. We've had an action plan. It's been successful in parts, it's been unsuccessful in other parts. I think in the coming years we've got to focus on the areas where we have not had success so far. And of course the contribution of the European Parliament, but also of the Member States and stakeholders through the types of projects we've been hearing about in the IMI project, plus the WHO Global Action Plan. Because there's no point in trying to solve the problem at the national level. There's no point in trying to solve the problem at the European level. The whole issue is a global issue, and if we don't manage to find a solution which is global in nature, we won't get anywhere. So I think Europe has to be prepared, the member states of Europe have to be prepared, but we've got to really find a solution as well which works on the international level.
But also policy making in the European can be speeded up, as it is done in certain crisis situations, about the refugee catastrophe in the Mediterranean, the boycott on and from Russia. With 25,000 people in the Union dying every year, as you were saying, is this not a crisis situation?
It's not a crisis situation, as my colleague from Thailand said, with Ebola. I've been living through Ebola for the last year, and that means meetings every day or twice a day or 3 times a day. We're not having meetings twice, 3 times a day on antimicrobial resistance. So the perception of antimicrobial resistance as a threat is not there in the same way as it is for pandemic flu or for Ebola or for E. coli or for some of the other threats that we've been through. And I think that's one of our challenges, is really to try and make people aware, make the member states aware, make the policymakers aware of the potential disaster that's facing us here, and the disaster and the threat that it poses for medical interventions in the future. So really I think we've got to up our game, as we say in English, and make sure that we put in place mechanisms to react to this situation in an appropriate way and in a rapid way.
Yeah. Do you want to comment on that? Perhaps Gilles? Shortly?
Yes, I think the issue about antimicrobial resistance is also an issue of awareness. I think the Ebola crisis taught us that yes, I think communication is critical, and if we don't communicate more about the risks for people from AMR, I think we'll be in the same situation in a number of years from now. So I think it's urgent also that we do communicate better about this. Because this is the difference. Ebola was an epidemic. There was 11,000 deaths, 26,000 people contaminated. Here we are talking in Europe only about 25,000 deaths, 700,000 deaths in the world in 1 year. So I think we are talking about an epidemic of a very large scale here. So, but the communication about it is not proportionate to the scale of this disaster. And yes, patients are becoming more and more aware also of the difficulty to treat some common infections. So I think we have to build on this momentum, political momentum from the World Health Assembly, but also from the countries like the US and the G7. Mrs. Merkel is heading the G7 in a couple of weeks from now. The EU presidency also from the Netherlands will have also this on the agenda. So I think there are a number of factors that on which we can build.
Okay, thank you. It's now 10:30, or rather 10:34, and at 11 o'clock you will go into today's workshops. We'll have, I think, a picture here of the workshops. Well, that picture is here to give an applause to our panel.